We speak further about this with Professor Harry Hausler, TB HIV Care CEO. A very good evening to you, and thank you so much for joining us. So we've been grabbing snippets of conversation here, particularly about preventative measures. One of the things that we haven't really focused on is contact tracing, but I want to focus first on the household contact tracing and the screening to ensure early diagnosis and treatment of infectious individuals.
Thank you so much for having me. And as you say, it is very important that we do contact tracing. You know, in South Africa, there were an estimated 280,000 people who got sick with TB in 2022, but only 224,000 were notified and started on treatment. That means 56,000 people were untreated and continued then to develop more complicated disease and transmit TB. So a new approach that we're taking is called targeted universal TB testing. That means that every time there's a person with TB in a household, we should visit that whole household and collect sputum from all of the household members. Those who test positive can be started on treatment. Those who test negative now are eligible for TB preventive therapy to help prevent them from developing TB.
So just in terms of TPT, when you look at adults and children, are there differences in approaches and procedures, treatment? Tell us a little bit more about that.
Sure. Well, in the past, we only treated child contacts, so children under 5 who were household contacts with TB preventive therapy. But last year, the National Department of Health published new TB preventive therapy guidelines. I was actually part of the TB prevention task team that helped to develop those. And with those guidelines, we now have changed the eligibility criteria. So any household contact of any age, as well as all people living with HIV, are eligible for TB preventive therapy. And we have shorter regimens as well. So now instead of having a 6-month regimen of isoniazid only, we have 2 new regimens, a child-friendly formulation called 3RH for children, and then for anyone over 25 kilograms, there's a really revolutionary new TPT regimen. It's only 12 doses, so weekly doses over 12 weeks. And then that's called 3HP. And so with these new regimens and the new eligibility criteria, we really need to scale up access to TB preventive therapy.
And this other approach, that of TB and HIV diagnosis and treatment, so the preventative measures that you're taking there, and when you look at the data since the inception of this program, has it helped reduce the incidence of TB infection in communities, or even achieve what you call TB-free?
Well, it's too early to say because we haven't scaled up sufficiently, but definitely TB preventive therapy is an important element to end TB. It's an important intervention. So with targeted universal TB testing, we can actually, what we do is we collect sputum from anybody who's from a high-risk group. So that includes people living with HIV, household contacts, people who've had TB in the last 2 years. And overall, 6% of those categories of people will test positive for TB. And then by implementing TUT, the abbreviation Targeted Universal TB Testing, or TUT, we actually can increase TB diagnosis by 17%. So with these interventions, with the new shorter regimens, the better treatment regimens for TPT, but also for drug-sensitive TB, there's a 6-month and now a 4-month regimen that may be coming up available soon. And for drug-resistant TB, we have a new regimen called BPAL, which is also only 6 months. So we can end TB. TB is preventable and curable.
So just while you are facilitating the diagnosis and determining the treatment, just take us through what I believe you call the primary outcome and the secondary outcome, including these tuberculin skin tests for positivity that you're taking with children.
So the tuberculin skin test is a way to that will help to diagnose TB in children. It's not used in adults, but it's a test of infection. And whereas, for what we really aim to do when we diagnose TB is to get a bacteriological confirmation. So South Africa was really at the forefront in terms of rolling out what's called Gene Expert. It's a nucleic acid amplification test, but it amplifies the genetic material in a sputum sample. So it's really critical that we try to get a sample, a sputum sample, or from children a gastric aspirate, and test it with the Gene Expert. And now there's some new other diagnostics that are becoming available, so that we have bacteriological confirmation, and then we can be sure that we're treating TB disease.
When you talk about that bacteriological confirmation, please just explain a little further, but maybe in more accessible language. What are we talking about here, especially a multi-drug resistant TB, because we have seen incidents thereof. And does the age difference matter? Does it influence the test results that you're getting?
It is more difficult to get a sample from a child. That's why sometimes we have to do gastric aspirates, take a sample from the stomach. But when you ask about bacteriological diagnosis, it's basically finding the germ in a sample that we collect from somebody who may have TB, and that's done we have a number of ways actually. To diagnose. Now, we also have a urine test called urine lamb. Chest X-ray can help, but the finding the germ is the key test, and that's done in a laboratory. What we need is point-of-care diagnostics as well, so that someone can come to a clinic, get a test, find out the result, and get started on treatment right away, and those are coming soon.
All right, thank you so much for speaking to us, Professor Harry Hausler. He's TB HIV Care CEO, speaking to us on this World TB Day, some of the advancements that have been made, particularly in terms of preventative care.